Good morning, everyone. The committee will come to order. I welcome our witnesses in person and those that are appearing distantly. We look forward to their testimony and getting a better understanding of where the Department of Veterans Affairs and the third-party administrators are in administering the Mission Act. Also very interested in hearing more today about the caregivers implementation as well. Almost every member of our committee, though not physically present at the moment, some are joining us in person and others will be joining us. Almost every member of our committee will be participating, is expected in today's hearing. The focus of today's hearing is the implementation of Title I under the Mission Act by the Department of Veterans Affairs relating to veterans community care programs and the program of comprehensive assistance to family caregivers. I scheduled this hearing because of my dissatisfaction with the pace of mission implementation. While VA officials were invited to participate in today's hearing to discuss the critical programs they oversee, the department chose to decline that invitation. This committee and the VA shared a common goal to pass the Mission Act in 2018 to better serve veterans and their families, and we continue to work together to address important issues for our nation's veterans. I would expect them to be here for this conversation to share all they've accomplished since the VA was transformed with this legislation and to discuss what needs to be done to make improvements. The VA is an integral part of this dialogue, which is why I plan to hold subsequent engagements with the VA officials to discuss Title I implementation. I'd be remiss not to recognize the unprecedented challenges of this year due to the COVID-19 pandemic. The dedicated staff on the VA's front lines deserve both our thanks and recognition for their essential role in caring for veterans and fulfilling the VA's fourth mission. However, at a time when accessing health care is of utmost importance, the VA has struggled to uphold the Mission Act's requirements of providing veterans access to community care. My staff and I continue to hear complaints from veterans and providers related to poor communications, lapses in continuity of care, and network inadequacies. Third-party administrators like TriWest and Optum here with us today are valued and essential partners in the delivery of care to veterans through the Community Care Network. You play an important role in building a robust and resilient community care network that is able to provide veterans timely access to care and to make certain community providers receive prompt payment for the care and services they provide. When the VA released stringent access standards for community care, I was encouraged to see more veterans would finally be able to access timely, quality care closer to home. However, once again, my staff and I have since learned that the VA's contracts with third-party administrators use a completely different set of standards to determine how veterans access care. Under contract terms, rural and highly rural veterans could be forced to drive up to 3 hours for care, which is totally unacceptable and contradicts the spirit of mission. I've discussed this glaring inconsistency with the VA officials for months, but despite VA's assurances publicly and privately, it is uncertain whether the VA has modified the terms of the contract. It appears to me that it's possible now for veterans to have a different access for care, certainly than the law, the Mission Act requires, different than the regulations of the VA, and perhaps different from VISN to VISN based upon the contract terms of the third-party administrators. As I said, we hope to learn more about this today. The Community Care Network is central to the Missions Act aimed to transform the VA's healthcare into an innovative and responsive 21st century healthcare system capable of addressing the challenges veterans face today and providing access to the care veterans deserve under the law. As such, I want to ensure that Mission Act succeeds and utilization of community care networks is accurately accounted for because there are sufficient number of local providers in the network for veterans to utilize. Much has changed in our country since the committee held a hearing on implementation of the Community Care Network earlier this year, but the intent and goal of the Mission Act has not changed. We remain committed to making certain that veterans who qualify for care in the community are able to get that care without unnecessary scheduling delays through a mature and geographically dispersed network of community providers that uphold the VA's access standards and that those providers are paid in timely manners. Congress has the responsibility to oversee VA's execution of the laws that govern the agency's responsibility to serve veterans, and this committee takes its responsibilities seriously. I believe some of the VA's most senior leaders might agree with me that while progress may be underway, It must move faster to enable community care networks to serve veterans as we all envisioned. I want to know how the VA is making progress in working with their third-party administrators to transform the VA and offer veterans access to the health care they deserve. Another essential component of the Mission Act is the expansion and eligibility for program of comprehensive assistance for family caregivers to all generations of veterans. Many caregivers have been providing essential services for their loved ones without support for years and in some cases decades. As veteran caregivers are often the main caretakers for their loved ones, many can experience depression, anxiety, and other mental health conditions attributed in part or solely to their experience of caregiving. The stress associated with caring for a spouse or family member with a set of complex healthcare needs is a real and present concern for veteran caregivers. It is essential that the VA support for caregivers, these mental health challenges, be addressed effectively. Mission outlined a two-phase process to expand the supportive resources with an anticipated start date of October 1st, 2018 for Phase 1. Phase 1 implementation only just began October 1 of this year, 2 years behind schedule. This delayed rollout will result in caregivers needing to wait even longer to be part of the vital support program. I look forward to hearing the testimony from everyone who will be taking part in today's hearing about the issues that you face in your work to help care for and serve veterans, and steps that the VA can take to make certain both of these important programs are functional and able to deliver good results and outcomes for veteran caregivers. I apologize, my opening statement is longer than my usual practice, but I had sufficient desire to say a few things this morning as we begin this hearing, and I now want to yield to the ranking member and author, Senator Tester.